Okay, let's keep going. So the rest of the lecture, we're gonna look at some big muscles in the body. And in the head part, let's look at some muscle. Frontalis, that's the muscle in your forehead. Orbicularis oculi, that's the muscle surround your eye. And you have another orbicularis called orbicularis oris, that's the muscle surround your mouth. And now let's look at this one called the masseter. And that's the one go to your zygomatic process and connect your jaw, your mandible to the zygomatic process. So when you chew, you use the masseter. And now let's look at this one. This is called the sternocleidomastoid. That's the muscle move your head in your neck. Now let's go to the neck area. The anterior part called sternocleidomastoid. Let's go to the posterior part called the trapezius. Trapezius is a big layer of muscle. It goes to your whole back, to your shoulder, to your back, but its support connect to the occipital bone, so it can move your head. And the main mover of your head is sternocleidomastoid, but trapezius also help to move the posterior part. Now we go to the chest area. In the chest area, these muscles, they either protect you or they help for breathing. Like you have the rectus abdominis. That's the muscle. That's the six packs. People usually talk about, and that's the muscles for help you to breathe. So when you exercise, you use this muscle a lot. And muscle have layers. So this part have the rectus abdominis, and inside part is the internal oblique muscle. And oblique muscle goes in this direction. So inside you have the internal oblique. It actually moves in this direction. External oblique is this. External oblique, that's the outside layer. It move into this line called linea alba. That's the aponeurosis. That's a connective tissue. So inside move out, outside move in. That's those two oblique muscle. And these are the muscles between the ribs, so it's called the intercostal muscle. And this muscle called serratus anterior. So if you exercise a lot, you are able to feel or see this muscle. And this slide shows you the diaphragm. Diaphragm is a skeletal muscle, and it separates your thoracic cage away from your abdominal cavity, and it's the main muscle used for breathing. Now let's reach the appendicular muscles, your arm muscles and your leg muscles. So we're going to talk about all these muscles. Your arm muscle, the posterior view, okay, the big one in your back, you see the trapezius. So that's the muscle support your head, also go to your shoulder. And that's deltoid, that's the big triangle muscle, you take a flu shot. And the posterior view, you see the triceps bronchi, so that's the muscle in your back. Now let's look at the muscles surround your scapula. One you can see here is called the infraspinatus. So that's the small muscle create movement. When you move your arm, you have the small muscle, infraspinatus. So when we talk about the scapula, and we say this is the infraspinous fossa. So that's the muscle, infraspinatus. Okay, now let's look at the anterior view. Anterior view, you can see the deltoid, you can see the pectoralis major, and you can see the biceps bronchi. Now let's take the muscle away, and we see the inside. Inside surround the scapula, you found the supraspinatus. Subscapularis. Supraspinatus is around here. This is subscapularis. So that's the small muscle for arm movement. And this one called the teres major. Okay, now let's look at the posterior view. We talk about the deltoid, and this one is a big layer of muscle called latissimus dorsi. That's a big layer muscle. Muscle have layers. And now let's look at the inside. The inside part, you see the supraspinatus, infraspinatus, And let's add one more called teres minor, not major, teres minor. 1, 2, 3. So these three surround the scapula from the anterior to the posterior, from the upper, middle, lower, and the previous. They go to the previous sides, the subscapularis. So these four muscles completely surround the scapula and go to the humerus. So these four muscles, their function is rotate the arm and abduct the arm. So these four muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, these four muscles, we call them rotating cuff muscle. They are the inner layers and create your arm movement. So these four muscles, this is posterior view, and this is the anterior view. So posterior view, supraspinatus, infraspinatus, teres minor, and the anterior view, this is subscapularis. So 1, 2, 3, 4, they call the SITS, SITS muscle, also called rotating cuff muscles. And this video tell you about the shoulder movement. I will leave it to you. Now we reach the elbow. The elbow part, the main mover, that's of course the biceps brachii, but we also have the small muscle called brachialis. It creates exactly the same movement, it's smaller. And the wrist muscle, they can be divided into the flexor and the extensor. So these are the wrist muscle. And the extensor is in the posterior view. And muscle have layers, so in your arm part, they're all small muscles. And a lot of them have overlapping function. And the reason is your finger function is very important. You don't want to lose a muscle and lose a finger function. So they have a lot of overlapping function. So all these are small muscles with a lot of overlapping function. Now let's reach the leg. And the leg, we're going to talk about the thigh muscle and the leg muscle. So let's look at the thigh muscle. Thigh muscles, the biceps femoris, semimembranosus, semitendinosus, and sartorius. We're going to talk about all these four. So that's the lateral view. Lateral view, you will see two big muscles. One is gluteus maximus. You won't miss it. It's huge. This one in the pelvic joint. This one, TFL, tensor fasciae latae. And that's the muscle from the lateral view. You see this. It's actually muscle is this small part. It's a big band of connective tissue. And that's the lateral part. So when you do the abduct of your leg, you use this muscle. Now let's go to the anterior view and posterior view. Let's look at the posterior view. Posterior view, well, you can see the gluteus maximus. Now let's look at the thigh part. Biceps femoris. So in your body, you actually have two biceps. Biceps brachii in your arm and biceps femoris in your leg. So that's the lateral part, that's the medial part. Students usually get confused of these two because they look so similar, they're about the same size. So the lateral part is biceps femoris. The medial part is semitendinosus. This is semitendinosus. And the third one is semimembranosus. So semimembranosus, semitendinosus, and biceps femoris all together, you may heard this. This is called the hamstring muscle. So when you exercise your leg, go to the gym, exercise your hamstring muscle. That's this. Now let's look at the anterior view. Anterior view, you have the rectus femoris. That's the muscle here. So when you do the cycling, you go jogging, that's the main one, rectus femoris. And rectus, you have actually three vastus, but you can only see two here. The vastus medialis and vastus lateralis. 1, 2, 3. And the last one is actually being blocked by the rectus femoris. So rectus femoris, vastus lateralis, vastus medialis, and vastus intermedialis. All these four called quadriceps muscle. You may have heard this term, quadriceps muscle. So there are four of them. And now let's look at this one. This one is the longest muscle you have in your body, called sartorius. So that's the sartorius. Okay, so we talk about the quadriceps muscle. This 4 muscle in the anterior part of your thigh. You can see 3 of them: rectus femoris, vastus lateralis, and medialis. You don't see the vastus intermedius because it's been blocked by the rectus femoris. So these are the quadriceps muscle. And the muscle in the feet, okay, very important one, gastrocnemius. Gastrocnemius is your calf muscle. And that's this one, gastrocnemius. So all this one muscle, gastrocnemius. Gastrocnemius connect to your calcaneus through the calcaneal tendon. This is your strongest tendon you have in your body, but people break it all the time because people did not exercise, warm up enough before they exercise. And this calcaneus tendon also have a nickname called Achilles tendon. So that's the lateral view, that's the gastrocnemius. Okay, that's it.